Hello everyone, my name is Moshe Appel. I'm a clinical psychologist and I have a group practice called ADO Psychology Center. ADO stands for Anxiety, Depression, and OCD because those are the disorders that we specialize in. I also post videos on these topics on my website in case you want to check those out, which is adopsychologycenter.com. So tonight's topic is relationship OCD. So before we get into this specific subtype, let us briefly discuss what OCD is more broadly. Okay, so in society, many times people use the term OCD and really refer to perfectionism. So if someone says, I'm so OCD about everything, or he's so OCD about everything, they may be referring to people who are perfectionists or like keeping things in order and clean. But what OCD really is a clinical disorder that is characterized by obsessions and compulsions. Obsessions are intrusive thoughts, urges, or images that the person finds distressing. So for example, if someone has the thought of I'm contaminated or I'm going to get sick, or maybe I just hit someone with my car and even though there's no evidence of it, those thoughts are distressing and those would be obsessions. And then compulsions are what we do in response to the obsessions. So there are behaviors or mental behaviors. So maybe physically washing your hands or mentally reviewing in your mind, whether you actually touched a dirty surface to try to calm yourself down. So that's what OCD is more broadly. There are many different subtypes of OCD, but for the most part, except for a few exceptions, it's all the same disorder, just, coming up in a different way, or you can think of it as different flavors or different colors, but it's all the same disorder. And the mechanism of action within this disorder is that someone has an obsession which causes distress, causes anxiety or disgust or some other distress, and then they engage in a compulsion to relieve it. So some examples might be contamination, like I mentioned, harm OCD, where maybe someone has a thought of that maybe they hurt someone or they will hurt someone. And again, there's no evidence for this. It's just intrusive thoughts that cause distress to the person. A good question to ask yourself is, are these thoughts like part of who I am and I like being this way? In which case it might just be perfectionism or something else. Or are these thoughts distressing to me? So tonight we're going to talk about relationship OCD. Relationship OCD, there are really two types of relationship OCD. There is partner-focused and relationship-focused. Okay, and I'm going to give you some examples of each to make it more clear. In partner-focused OCD, relationship OCD, it's all about the partner. So is my partner attractive enough, smart enough, social enough, funny enough, moral enough? All of these types of questions are all about their partner, right? Now, when they're not triggered by the OCD, they kind of know, I like my partner, they are kind of funny, they're attractive, but when they get triggered by these obsessions, they have these doubts in the moment of, do I really find them attractive enough or funny enough and all that? I want to briefly differentiate this from BDD by proxy, body dysmorphic disorder by proxy, which is where someone is very much obsessed over a bodily appearance, like a specific body part in their partner, for example, or how their partner looks, and it's all about the look. Okay, so that's a different disorder. It's related to OCD. It's called BDD by proxy. But for our talk tonight, we're going to focus on the relationship OCD aspect, which is not just about the look. It's about, is this partner, good enough for me? And then the other type is called relationship OCD. The other type of relationship OCD is called the relationship-focused type of relationship OCD. And this type is where someone has intrusive thoughts of, are we compatible? Do I love my partner? Does my partner love me? Is the quality of our relationship where it should be? How does our relationship compare to other people's relationships? So as you see here, it's not so much about the partner, rather it's about the relationship between me and my partner. Common compulsions in relationship OCD include comparing, checking, ruminating, reassurance seeking. Googling is another form of reassurance seeking. So for example, someone might be going down the street and they pass by an attractive person and they say that person's attractive. And then right away they have the thought, wait, does this mean that I'm not fully attracted to my partner? Because if I was, why would I be thinking about how someone else looks? Or maybe they're sitting in a restaurant at dinner with their partner and they see another couple next to them and they say they look like they're having a great time and we're having an okay time, but it's not that great. What's wrong with our relationship? So these are examples of comparing as a compulsion. Checking might be checking in with themselves. How do I feel now when I'm with my partner? Do I feel great? And that's good, or maybe checking in how they feel when they're not with their partner. And if they feel good when they're not with them, they might ask, why do I feel so great when I'm not with them? Like, shouldn't I feel good when I'm only with them? If I'm by myself, why am I so happy? So all different types of, checking behaviors to check in and figure out why they're feeling a certain way or not feeling a certain way when they're with their partner or when they're not with them. Rumination is just thinking a lot about all of these thoughts again and again and again. Reassurance seeking might be asking people like, is it normal in a relationship to not always be into your partner? Or Googling, like, how do I know if I really love him or her? And so these are all different examples of compulsions that come up in relationship OCD. There are a lot of triggers for this specific subtype. So triggers are the things, usually they're external triggers, there could be internal triggers as well, but like an external trigger that kind of brings this all up for the person. So in contamination OCD, as you can imagine, if someone touches a public doorknob, that's a trigger to start getting them thinking about whether they are contaminated or not, right? In relationship OCD, there are many different things that could be triggers. For example, just seeing another couple can be a trigger, right? How does my relationship compare to theirs? Or social media and seeing people, being happy in relationships, reading articles about couples or relationships, internal feelings while they're with their partner or when they're not with their partner can be a trigger for all this type of material coming up for them. So as you can see here, like throughout the day, they can be bombarded by external triggers, constantly triggering these thoughts and these, obsessions over their relationship. It's also worth noting that there are two possible time points for relationship OCD. So you could be dating someone or before you're committing to a relationship or before you're committing to a marriage, or it could come after you have committed to a relationship or after you got married. And each one's going to have its own consequences, obviously. Like if you are in the dating phase still and you have relationship OCD, it can be very hard to make a decision as to whether this person's the right one for you. You might even break up with them at some point, only to then get back together with them, only to then break up again. And I've had clients where this has happened, where they broke up and they were together and they broke up again. So there can be those types of consequences. If you're already in a committed relationship or in a marriage even, it can have other consequences where you're constantly doubting the relationship. You can cause the relationship to deteriorate because of that. You could stay together but be in constant distress, or you might even want to get divorced. You could be distracted always and not be in the present moment, not enjoy the time with your partner. So as you see, there can be many consequences to, unfortunately, to relationship OCD. It's good to understand some underlying maladaptive beliefs that we find in relationship OCD. And some examples of those are, for example, if I'm really attracted to my partner, I should not feel attraction toward anyone else. Or the quality of my relationship should always be 100% like all the time. Or I should always be looking forward to being with my partner. Or I should never feel great when I'm just alone. I should feel like I'm lacking my partner. And another very important one is if I keep comparing, checking, ruminating, reassurance seeking, I'll finally find the confidence I need that I'm in the right relationship. And all of these beliefs are maladaptive because, first of all, they're not accurate. And second of all, and more importantly, they're not helpful. But these are some underlying maladaptive beliefs that often come up in relationship OCD. So how do we differentiate between ROCD, relationship OCD, and typical relationship doubting? And this is a question that many of you might be asking right now to yourselves, which is, in relationships, many people doubt whether they are with the right partner, or if they're dating, that's the whole process of dating many times, figuring out, is this the right person for me or not? And it could feel like you're ruminating a lot about it, and you have a lot of doubts, and you're trying to compare it to other couples. So where exactly is the fine line between relationship OCD versus normative doubting in relationships or while dating? And unfortunately, this specific subtype of OCD, I would say, is possibly the most unclear in terms of where to draw that line exactly. So there are many, many situations where it could come right up to the line, but not necessarily be relationship OCD, and other examples where it is relationship OCD. And it's very hard to tease out the two. I'm going to try to give you some ideas of what it looks like in relationship OCD versus normative doubting, and maybe how to tease those two apart. So doubts, questions, uncertainty is commonly takes place in romantic relationships, but in ROCD, the doubts are accompanied by strong feelings of distress and urgency. Okay, so that's one thing to look out for. The doubts feel very intense, the doubts are incessant, they like keep coming at you, you can't enjoy the present moment while spending time with your partner because you're constantly doubting and checking and comparing. So it's like, when you're with them, usually is when you're the most triggered. The doubts tend to be irrational. So when you tell someone else what your doubts are, they may say like, what are you talking about? Like, you told me how attracted you are, and all of a sudden you're telling me now like maybe you're not attracted at all to them. Like, that doesn't make sense. The doubts tend to get stronger as the relationship progresses, whereas normally things tend to get clear up as time goes on. The person usually has currently or had in the past other OCD subtypes as well. So if you're someone who deals with OCD and you're dealing with this, it likely, it's some evidence that it might be actually relationship OCD and not just normative doubting. And also, the gut feeling or the common sense that we all have seems to mean nothing to you. Okay, so normative doubting, usually you still have a gut feeling, you're like, it still feels right. You're able to like use your common sense or your gut feeling. In relationship OCD, you're like, I don't know what my gut feeling is. I just can't figure it out. So those are some questions you can ask yourself to differentiate between normative doubting and relationship OCD. And I'm going to repeat that even with these, the line can be very hard to differentiate, to really figure out, to delineate. And sometimes even if we wouldn't define it as relationship OCD, it doesn't mean that the skills I'm about to speak about next are not going to help you. So even if it's not technically a clinical disorder of relationship OCD, you'll likely benefit from a lot of the skills that we use in relationship OCD specifically. So what does treatment look like? So I would say there are three main components to treating relationship OCD. There's psychoeducation, exposure and response prevention, which is the treatment for OCD in general. It's like consider the gold standard treatment, and then acceptance. When it comes to psychoeducation, the first step is to correct all of the maladaptive beliefs as follows. Even though I'm attracted to my partner, it's okay to feel attraction toward other people and normal to do so. The quality of my relationship does not need to be and will not be 100% all the time. Relationships are not static. There is ebb and flow. All relationships need to be worked on. I do not always need to feel a specific way when I'm with my partner or toward my partner. I do not need to feel a specific way when I'm not with my partner. I can enjoy time alone, even if I'm not thinking about the next time that I'm going to get to see my partner. And one of the most important ones, unless I stop comparing, checking, ruminating, reassurance seeking, I'll never feel confident that I'm in the right relationship. So I need to stop all of those types of behaviors. So let's get into now the main ingredient of the treatment, which is ERP, exposure and response prevention, which is what we use for many OCD subtypes, although that's not the only treatment there is. So if some of you have tried ERP and it hasn't worked, it seemed to be too hard, there are other cognitive approaches as well that should definitely be looked into too, in addition to medication, of course. But in terms of exposure and response prevention, it's pretty straightforward. Response prevention refers to preventing yourself from engaging in the compulsion. So like I just mentioned, you have to stop comparing, stop checking, stop ruminating, stop reassurance seeking, and recognize that the more you do it, the more unclear you're going to become, the more distressed you're going to become. So OCD tricks us into thinking, and OCD is brilliant at this, if I did these compulsions and compared a little more and checked a little more, I'll finally get the confidence I need. And it's incorrect. So that's step one. You got to cut out the compulsions. And step two is the exposure piece, where you want to have more opportunities to practice preventing yourself from engaging in the compulsions. And so if you do exposures, you purposely expose yourself to some triggers. So if you see a good-looking person in the street, like, wow, that person is good-looking, good for them, and you move on, versus comparing and seeing why you're attracted and why not. Or if you see another couple and they're happy, you're like, okay, great. So purposely exposing yourself to certain situations to trigger yourself and practicing not engaging in the compulsions. Let's now turn to the acceptance piece. Here are some things that you need to accept. You have to accept that uncertainty is normal, especially in relationships, right? You're talking about two full human beings who are so complex, each in their own right, getting together now and creating this third kind of entity of a relationship between these two people. So uncertainty is definitely normal. No relationship is perfect. You have to accept that emotions naturally fluctuate over time. You have to accept that your partner may not be the most attractive, smartest, funniest person, right? You have to be a realist as well, and that's okay, and that's normal, right? No one's going to be the best in all of these aspects. You have to accept that no matter who your partner is, you will always have intrusive doubts, and no relationship can guarantee happiness. So you have to drop those notions of like, I just want certainty, I just want to always be happy. You have to drop that and just accept, life has a lot of happiness. Some things we feel more certain about, some things less. But you have to accept that no matter who your partner will be, even if you break it up with this one and get with someone else, if you have relationship OCD, you're always going to be doubting. OCD is also known as the doubting disorder for a reason. It's all about doubting, what if and maybe. And so it's not the partner and it's not the relationship, but rather it's the relationship OCD that's the issue here. And you have to accept that the love for your partner and their love for you will ebb and flow. And also that relationships have more to do with the effort you put into them than with who the person happens to be or who you happen to be. So how do you decide if the person you're dating is the right person for you if you have relationship OCD? You can say, okay, all this sounds great. I can stop the compulsions and all that, but I need to make a decision here, right? I need to decide, am I marrying this person, for example, or not? And how can I make that decision if I'm constantly checking and comparing and I feel like that they are the right person for me, but what if they're not? And this is such a monumental decision that I'm making. It's going to affect the rest of my life. How do I make that decision if I'm experiencing relationship OCD? So here are some tips for how to do that. First, when you're on a date with a person, you want to be fully present and not engage in any compulsions. If you're comparing and checking and seeing how you're feeling inside and seeing whether they're laughing or you're laughing or comparing to the couple next to you, you're not going to be fully present. You're not going to be able to actually get information or see if this person's a good fit for you. So that's number one. When you're on a date, you want to be fully present in that date, and any thoughts or intrusive thoughts that come into your mind, you want to kind of like recognize them and say, thank you for that thought. Great. And move on. You want to stay focused, stay present on the date. You want to learn how to separate your symptoms of ROCD from genuine feelings about the relationship. And this can be done with the help of a therapist, of course, but trying to tease out am I attracted to this person at all? Or am I not really attracted to them, right? Or am I attracted to them, but every now and then, especially if I see someone else, I immediately think wait a second, I don't know if I'm fully attracted or how attracted. So you want to differentiate between your ROCD doubts versus your genuine feelings. It might be helpful to write down ahead of time some qualities that you're looking for in a partner and see if they match up to that list. But be careful not to engage in this process excessively, right? You don't want it to be reassurance seeking. You don't want it to be another compulsion. You don't want to be creating lists and lists and lists, and you don't want to be spending hours and hours on them. So it could be helpful to get some concrete evidence, some concrete information that way, but you definitely don't want to do it to an excessive degree. Similarly, you want to set aside specific time for problem solving and limit your analyzing to those preset times. Okay, and this is done for a few reasons. Number one, if you're just going to try to problem solve throughout the day randomly, number one, you're probably going to be doing them in the moments of your triggers. The second you're triggered, you're like, okay, I don't know if I really love this person, or I don't know if they're fully attractive for me, or if they're funny enough or smart enough. Let me try to figure this out and problem solve. No. In the moment of the trigger, you're likely to ruminate and engage in compulsion. So you don't want it to be done in the moment of the trigger. Rather, you want to have a preset time. You decided ahead of time, 6 p.m., I'm going to sit down for 20 minutes and do some problem solving. So that's why it's really beneficial to have a preset time and not do it randomly throughout the day, especially not when you're triggered. Also, you want to structure that time in such a way that it'll be focused on problem solving versus free rumination time. So what does that mean? You want to set a goal. What is my goal for this session that I'm sitting down now? What are the things I'm going to be contemplating? How am I going to create a pros and cons list to figure it out? So you want it to be at a preset time, a limited amount of time, goal-oriented, problem-solving oriented, not just free rumination. Another tip might be to seek input from trusted friends and family members who know you well, not as reassurance. You don't want to get them to tell you, yeah, it's going to be fine, because again, you'll never squash the doubt, and that reassurance will just make you never be able to be confident enough on your own. And you're going to constantly be needing reassurance. But if they know you well, you could get input from other people and see what are your thoughts about this person. And sometimes outside information can be really helpful in this case. Another approach, I think this is from Jonathan Grayson, I think he calls it the gun to the head approach, and this is used in many OCD subtypes. Pretty much, gun to your head, do you like this person or not? Are you attracted to them or not? So trying to get into your common sense or your gut feeling and not the overanalyzing. OCD makes you think that the more you use your brain to figure out the answer, the better off you'll be, the more clarity you'll get. And usually that's not the case. In OCD, usually you're going to get to a more clear and correct answer if you use your gut and your common sense than overanalyzing with your brain. And last, you want to remember that successful relationships have more to do with the effort you put in than the specific qualities your partner has. So most people, as long as they're generally nice people and as long as you generally match up, you can make the relationship work and flourish. But it has more to do with the effort that you put into it versus the relationship itself. So when you're making this monumental decision, keep that in mind, and that can reduce some of the pressure, knowing that as long as you're basically compatible, now it's really up to you guys to figure out how successful the relationship is going to end up being. So in short, let's summarize here what we spoke about. We spoke about the two types of ROCD, partner-focused or relationship-focused. We spoke about common compulsions, including comparing, checking, rumination, reassurance seeking. We spoke about maladaptive beliefs underlying relationship OCD and how to differentiate our OCD from typical doubting. We spoke about what to do to figure out who you should, if the person you're dating is the right person for you or not. We spoke about what treatment looks like, and hopefully this gives you a brief summary on what ROCD looks like and some tips of what treatment looks like and what you can do about it, if you have it. A common question that comes up often is, how do I know if I need therapy? Because, I'm doubting, yes, and how do I know if I need therapy? And the answer pretty much is usually the same for me, which is there's a specific criteria in the DSM for almost any disorder, which says if you are, if the disorder is causing you clinical levels of distress, which just means it's very distressing, okay? Or it's functionally impairing, which means it's impairing your functioning. You can't function well in your relationship, you can't function well at work, you're always distracted. If you're either having clinical distress or functional impairment, you likely want to see a therapist. Now, if you're not at that level, it's really in your hands. Therapy can often help with a lot of these things, even if you don't meet full criteria for relationship OCD, for example, but you're still struggling. You get an outsider's perspective, you get a supportive environment, it could be helpful, but it's not always necessary. So, figure it out for yourself, I guess, if you want or not. You could always try it out. But I definitely think if it's functionally impairing or it's high levels of clinical distress, it's worth, talking to a therapist. Thank you for joining. The next live I'll be doing is in 2 weeks. It's going to be on religious OCD. And I also post videos on these topics on my website at adopsychologycenter.com. So if you want to contact me or see other videos, check the website out. Thanks all for joining. Take care.